The first question that I want to start with is, what is a standard, treatment plan for somebody with PCOS?
Okay.
I know you've said the last time that it differs from patient to patient because of other health risks. But if you have
that will be there anyway.
Yes.
Standard treatment in allopathy. Okay, if you take in allopathic treatment, I should say there is no like permanent solution for PCOS. Okay, what treatments will be going on is taking birth control pills to regularize cycles, or laparoscopy for drilling cysts, the so-called cysts, for drilling the cysts, and for treatments. So this is a standard with respect to allopathy.
Okay.
But this is not working. So many like women are suffering with this.
Yes.
Still suffering. There is no cure. It's not the solution, right? What is the proper solution? The standard treatment for PCOS is addressing the root causes. Basically, it is because of poor lifestyle and modern lifestyle. So root causes, what are those root causes? I have explained in one of our sessions. So those root causes lead to insulin resistance, inflammation, and hormonal imbalance. By addressing those root causes, we can reduce these three things. Okay, insulin resistance, hormonal imbalance. Then you will come out of all the symptoms of PCOS.
The second question that I want to ask you is, there are some standard side effects of PCOS, right? For example, there are people with type 2 diabetes. There are people with high cholesterol problem, high blood pressure, heart and blood vessel problem, thyroid gland problem. Apart from these often talked about problems, are there any other health concerns that we should be aware of?
So these are complications, okay? Whatever your diabetes, hypertension, all these are complications of PCOS. So apart from this, you did not cover cancer, okay?
Yeah, I was that.
Yeah, so because of chronic inflammation, it may cause endometrial cancer or breast cancer if you're not taking care of that.
Yes, so that covers my second question about cancer. So the correlation between cancer and PCOS is evident, is it?
Yeah. Yes, endometrial cancer.
And this can be, avoided if we just make changes in our lifestyle.
Yes, absolutely.
And you are one, Dr. Sreevani Karnav, who is committed to getting into the root cause of every individual and helping everybody who comes to you diagnose their root causes and help them.
Yes.
That's a very powerful mission. Ma'am, we often talk about insulin resistance, and you've covered this before, but just for our viewers' benefit, how do we treat someone with insulin resistance and PCOS?
Yes. So insulin resistance is basically because of accumulation of fat in the cells. Okay, if you want, I will share my screen and explain to. So this is a picture of a cell. I'm not sure lay people will understand it or not, but I will try to make it understandable. Okay, so this is the structure of a cell. Okay, so basically our body is made up of cells. Yes. Okay, so cells together form tissues. Tissues together form organs. Organs together form organ system or organism or human body or an animal or any kind of. Okay. Right. So basically the functional unit cell. So in this cell, when fat gets accumulated, fat starts accumulating, then what happens? These are the insulin receptors. Okay, for every cell, for every hormone, there will be a receptor. Okay. So receptor for insulin hormone is different. Receptor for estrogen hormone is different. So this the structure will be the like that only. Okay. The just like a key fits into a lock, one key cannot fit into another lock. Right.
Yes.
Similar. Yeah. Insulin receptor can attach. Insulin hormone can attach to insulin receptor only. So when this insulin hormone attaches to this receptor, it undergoes some change and allows glucose to enter the cell. So this is a big function. So when fat starts accumulating in the cell, what happens? These act as a chewing gum, and they don't make these insulin receptors don't function properly, efficiently. Then it signals our pancreas to secrete more and more insulin because glucose is accumulating in the blood. It is not efficiently coming inside the cell. This glucose then triggers our signals our pancreas to secrete more and more insulin. So that if the quantity of insulin is more, there are chances of functioning of the receptors more. Then glucose comes inside. So that way, sugar levels will be maintaining initially. Though we have high resistance, initially sugar levels will be maintaining. Later, what happens? It gives up. Like pancreas will give up, and then our sugar levels will not be in control, and we will be landing up in pre-diabetes and over diabetes. This is basically insulin resistance. So when this fat accumulates in the cell, another thing happens, that is mitochondria, which are the powerhouse of our cells. They reduce in the number. Powerhouse of the cell means we will be active, we will have energy because of these mitochondria. So when fat cell accumulates in the cell, our energy levels drop. We feel low energy throughout the day. That is also there. Okay.
Right.
Yeah. So then I will tell you more in understandable way with these cartoon pics. This is like insulin hormone. Okay. This is feeding our cell with the sugar. So it is taking happily. Actually, it takes happily when there is no insulin resistance. Everything will be happy, no problem. But when insulin resistance happens, when fat accumulates in the cell, it will not accept the glucose happily. Okay, so
this is very nicely explained.
Yeah. So I took it from some Google Pics only, but I liked it so much. Yeah. So what happens? This high insulin in excess is not good for our body. It signals our body to store more and more fat and leads to obesity because it is an anabolic hormone. Insulin is an anabolic. It adds more and more fat and weight to our body. Then it even causes inflammation. It causes oxidative stress also. It increases vagal nerve gastric acid production. That means a kind of gut disturbances, acidity, bloating kind of things also can be there. Then it alters sex hormone production. Like in PCOS, what happens? Low testosterone. I mean, in PCOS, low estrogen, high testosterone. In males, what happens? Low testosterone, high estrogen. That kind of happens because of high insulin. So that way. So virilization in women and feminization in men. And it also causes fatty liver disease.
Right.
So the problems with the insulin in excess.
Right.